Assalamu alaikum. The communication day starting with Mr. Sami Albert, 35 years, man admitted with spontaneous pneumothorax in 3 days. He didn't need any intervention. Patient is ready for discharge. Please discuss with him the diagnosis and precautions and address any concern.
Okay, start.
Just give me a second to share the timer. Okay, you can start.
Okay. Hello, I am Dr. Ghanem, Dr. in clinic. Today, may I confirm you are Mr. Sami Albert, 35 years old?
Yes, doctor. I am Sami.
Okay. Hello, Mr. Sami. We are here to discuss issues related to your health condition. Is it okay with you?
Please, doctor, yes.
Okay. During our conversation, if you want to ask any question, please don't hesitate to stop me, okay?
Okay, doctor, but first I assume to talk with your consultant. I admitted here since 3 days. No one talk with me. They told me that today I will discuss it with your consultant. So where is your consultant, doctor?
Okay, Mr. Sami, I appreciate your concern. I need to tell you that I am one in charge here today. And I am here to answer all your questions. If
Okay,
it's okay
doctor,
with you.
but your consultant now not respect me. Where is your consultant? They told me that I will meet your consultant. I wait here since 3 hours till now.
Okay, I understand you, Mr. Sami. I really appreciate your feeling, but because of shortage of time and many problem, he couldn't come. But I'm here to answer all your concerns.
Okay, doctor, but I feel really
Okay.
upset about that. Yes, okay.
We are sorry because you are feeling like that, but we are here work as a team. So if you want anything, we all can support you and can give you all the care you want. Okay.
Okay, doctor, I improved today, and I'm okay. Thank you very much.
Okay. I understand that your symptoms are improving, and this is very good news to hear. So could you please tell me what do you know about your condition?
I didn't know anything, doctor. I admitted here since 3 days with shortness of breath and chest pain. Since 3 days, no one told me what I have. A lot of investigation, a lot of scans. No one told me why. No one told me what is my condition. I want this doctor to know what I have.
Okay, Mr. Sami, I can understand the worries that you have, and I am here to tell you what is going on. Okay?
Okay, doctor, please.
So, you came here because of this shortness of breath, and after we did the scanning and the chest X-ray, we found that you have a condition. It is called spontaneous pneumothorax. Do you know about it?
No, doctor, no.
Okay, let me explain to you. Spontaneous pneumothorax. This condition happened to your lung. Let me draw to you. This is your lung, and this is the covering of your lung. And this is like an air leakage into the lung, into your lung. Okay, and
Okay.
this causes shortness of breath and or difficulty to breathe. But I think you told us that it is not caused by trauma and nothing like that. So it is called spontaneous. I mean, no exact cause we know.
Okay, doctor.
Okay.
So it is serious, doctor? It is serious condition?
Okay. In your condition now, it is not serious, and you are ready to go, and no danger to your lung now. But if it happen again, it become recurrent. This will cause problem to your lung function and can affect it and can
doctor.
make more shortness of breath. Okay, are you with me?
Yes, doctor, yes, but what is the cause of this condition? Why I have this condition?
Okay, for now, after our investigation, after our test we didn't find a cause, so we will consider it like it is happen without a cause, spontaneously. But if it happen again, um, there will be some causes for it. Uh, so what we need to do is not to happen again. This condition not happen again. Okay,
Okay,
so we will tell you some precaution to follow, so prevent it from happening again. Okay.
okay, doctor, thank you.
Okay, so before we start, can I ask you some question about your social life?
Yes, doctor, sure.
Okay, what do you do for living?
I am a pilot.
Okay. Okay. um, okay, this job is with this condition very dangerous in your job, because when you are in the plane, there is a change in the pressure that could affect the pressure in your lung and could cause this again.
Oh, doctor, never. So I will not be a pilot?
I'm sorry to tell you that um, you need to talk to your manager to reallocate you, or do some help for you, because this can cause this condition to come again.
Doctor, I will be out for this job. I like my job. It is where I live. How
I
can I
can
live?
understand. Yes, I can understand, but this is your life, and
You know, doctor, I am a pilot. I can't do anything other than a pilot. I like this job.
I can imagine this is very difficult for you. Yes, but this condition, if happen again, it can cause a lot of problem, a lot of condition, a lot of complication to your lung and to your body. It can even cause like respiratory failure, infection, a lot of complication. So the main concern now is to try to figure a solution for this job.
Okay,
Our
doctor, it is temporary, or for how long I will need to as a pilot? For how long?
I think this is not temporary. I think this has to be for long time,
For long time, for how long? 10 years or for life?
maybe for life, because this condition
Oh, doctor, it is very...
is precipitated mainly by the change in pressure.
Okay, doctor, okay, okay.
I can understand how this is bad for you, but
But please, doctor,
our,
please don't tell my company about that, please.
okay, it is your confidentiality, I know, but you have to tell them by yourself, because this is your life, and you will have other lives with you in the plane, and this could affect them.
No, doctor, I will not tell my company. No, no.
But this is
I like
very
this job.
dangerous. This is very dangerous for you and for all the all people will be on the plane with you.
Okay, doctor. Thanks for your advice,
Let
but I will not tell my
please
company.
please think in this matter again, because this is very
2 minutes
important, and
left.
this is
Okay, doctor.
okay.
Okay,
Okay, please think of it again, and I will talk
okay,
to you again. Okay, because this is a very dangerous situation. Okay.
okay, doctor. Thank you.
Okay. Okay. Do you smoke?
Never, doctor, never.
Okay. Do you drink alcohol?
No, never, doctor.
Okay. Do you have any hobbies?
Yes, doctor, swimming. I like
Okay.
swimming. Yes.
Swimming, but no diving, right?
No, sometimes I have scuba diving, yes, with my
Okay.
friends.
It is the same situation. Scuba diving has also change in pressure, and this could affect your lung, and this is it is very forbidden for your condition. This is very bad. Can worsen your condition
Yeah,
very
doctor,
much.
for how long should I stop scuba diving?
This is permanently. This is permanently.
Oh, doctor, I leave my job and no scuba diving. What I will do in my life?
I think there is a lot to do.
good surrogate.
Okay.
Yes.
Okay. Okay. So what do you think about what we talk about? What this
Okay,
situation?
doctor. Okay, thank you for your advice, but I will not tell my company.
I'm sorry to tell you that you have to tell your company because this is a dangerous situation, and in this situation, um, we sometimes have to break the confidentiality because you will harm others. I don't need to do this. Please
Okay,
do
doctor.
it
What?
yourself.
Okay, what if I
And
not told my company? What will happen?
um, um, this is very dangerous situation. So you need to think about it again because there are many lives will be with you, and this can not even endanger you, but all these. Um, so please rethink again.
Okay.
Okay, doctor.
Okay, I will give you more time, and then I will come to discuss it with you again. Okay, I will give you leaflet brochures about this condition to know about it more and to know how it is dangerous with a changing in the pressure and with some job like your job or some hobbies like scuba diving. Okay.
Okay, doctor. Thank you.
Your time is up.
Okay.
Well done, Dr. Sarah.
Sorry,
No
Dr.
problem.
Sarah, that I have to be a good surrogate.
Yes, you are, Dr.
Sorry,
Mahmoud.
sorry.
No problem. We have to
Okay.
learn and we have to
Yes,
train with
yes.
difficult and
It
such
is very
kind of survey.
difficult. Yes, you start discussing about pneumothorax. You find the surrogate is angry and like that. So when you start, I tell you, I waiting you for your consultant. Where is your consultant? I waiting here says 3 hours. So you there is a solution told that you are assumed to talk with my consultant, but for urgent situation, he asked me to talk with you about your condition. Is it okay with you? So he will tell, okay, doctor, no problem. It is the first thing. Second thing, I didn't remember. Second thing, what is that? Yes, when I told you, don't tell my company. You can tell him that they will usually they ask us for like the cause of sick leave, and we can't hide this information to your company. And about that, these regulations are made for you and for your safety and the safety of others. And I am sorry, it will be not good if your company knows that you have a problem with pressure like that. But I'm sorry for anything. Thank you, Dr. Sar.
Okay, so we can say that when your company asks for the cause of this sick leave,
The
we
cause
can pause, we can call,
we can't hide this
we
information
cannot
for him.
hide this information. Okay.
Yes, it is a good solution. And
Okay.
also, when I ask you, should I have for how long I should stop as a pilot? You can told me you will be assessed in the clinic
Yes.
regularly with the chest consultant, and they will decide. They will
Yes.
decide for how long you will be stop from pilot. But for now, you should stop as a pilot
Okay.
Yes.
and stop flying. Yes.
Yeah, well done, Dr. Sarah. Again, any solution you offer regarding, yes, he's busy, I'm here to address you, all these are accepted. But the best, as Dr. Mahmoud said, you can tell him he sent me urgently and he's busy somehow doing some surgery, doing some procedure. That's why I'm here to address your concern. He has busy duty. Anything you can say, he will never stop the meeting, okay? Just try to calm him down in the beginning. And always, I'm writing the patient name, in two names. Try to train yourself to identify the patient by two identities. The name, the father and his name, I mean two names and the age. Then you can call him by first name or what you want me to call or how you can I call you today. This is regarding the introduction. So whatever the patient or the surrogate is angry, try to calm him down by any way. Okay, I'm so sorry. Always appreciate and say sorry. I'm sorry for your suffering. I'm sorry for your frustration. We are here to address your concern. We are here to help you, to provide support. Okay, try to calm him down because if he kept angry, you'll be more stressed. And try to go to your task direct because if he argue with you more on this point, you will waste time and also he will make you more stressed. Let's go to the task, which is pneumothorax. As Dr. Mahmoud did, he want to be flying and he's a pilot. But the most important thing here, he has very sensitive position and he has also a lot of lives with him. Yes, we care about your life as well as for the passenger in your flight. That's why we are taking care of you and for them. You are precious for us and for them. Who's responsible to reallocate you? As Dr. Someone wrote, occupational worker. We will contact your company to reallocate you. Temporary, okay? I can remember from the last guidelines, the patient with pneumothorax can stop flying for 2 weeks. This is what I remember. I will share it again in the WhatsApp and to be more updated. Okay? Spontaneous pneumothorax can fly after 2 weeks of resolving of pneumothorax. Then, if it recur again, the only solution is to do pleurodesis, pleurectomy. If he did it, he can fly. I guess it's clear. Anyway, in the exam, for the sake of the exam, you can say, I'm so sorry, I can't tell you stop flying temporary until we assist again by our doctor or by our team. They will update you about the duration and the availability to fly again. Always try to be diplomatic in your answer. Don't give frame time. As we all of us deal before any stopping or any holding, try to be diplomatic in your answer. We will keep holding until we assist again. But if he asks you specify, please, for me the duration, and you can say it might be 2 weeks, and I will be back to the uh, regulation, aviation regulation, and I will update you about it. Or I will call my consultant. I will update you about the duration. Okay. This is regarding the duration of flight. But if you want to fly again, I can remember after pleurodectomy or pleurodesis, patient can fly again. Uh, this is the only solution for his safe flight. Since he has pleurodectomy, so no more pneumothorax will happen. He can do also the diving. Good thing also, Dr. Sarah, you ask about hobbies, specifically the diving, because it might also harm him and it might lead to another pneumothorax. Smoking, of course, you have to stop him if he is. The alcohol, and you can also ask about any strenuous exercise you are doing, any heavy work or carrying heavy objects. All this can lead to pneumothorax. But what the reason? It's unknown. It's called spontaneous, so it happened without reason. The last point was, yeah, don't tell my company. I appreciate your worry and be sure this meeting is confidential. Nothing will be disclosed to others unless it will harm your job or it will harm others. If he insists, as you said, I'm so sorry. Sorry, I receive a call. That's why. You can hear me now?
Yes, Dr. Basim, yes.
Yes, okay, back to the explanation. Whenever he argues you on this point, sorry, I can say it's unsafe to leave you fly in this condition. However, if you don't want to tell them, it's my duty to breach this confidentiality, or let me arrange a meeting with my consultant, with your manager, or with your company. We can tell them in a safe way. So you will not lose the job and you will be safe. We can give you sick leave until you will be fine. Okay? But don't argue with him in this point. Don't let him talk along in this along for this point. I mean, don't let him spend long of time saying no. I will tell. No, don't tell. No, you have to tell. No, I will not tell. So if he insists, okay, I can arrange a meeting with my consultant. He can sit with you to convince you, or we can do co-meeting with your company along with our consultants. They can solve this problem. But if you feel he will not tell and it will be dangerous, yes, you have to say, I'm so sorry. It's our duty here to inform them as it carry a risk for you and for others if you didn't tell the company. Then a leaflet brochures websites and thank him. I hope it's clear now. Someone wrote 1 week after complete resolution, he can fly. Yeah, this is new nice guideline. I can remember either 1 or 2 weeks. Anyway, I have it in the WhatsApp. I will share it again. Anyway, again, don't tell frame or don't specify duration. Say, I will go back to my consultant. I will let you know. I will go review the aviation regulation. Any answer, avoid to give specific duration. But if he insists to know, please, what is the duration? You can say it might be from 1 to 2 weeks after resolution of your pneumothorax. Okay. And the explanation, Dr. Sarah, you did good when you draw to the patient, but you said air leaking of air around the lung or inside the lung. Sorry, it's not inside the lung. I guess you said like that, but supposed to say air leaking around the layer or the layer covering the lung. It's like that, and you can draw the lung and one layer around it, and the air here being extra or large in size, which can symptomize by, or it can lead to these symptoms in the form of short of breath, chest pain, or even you can have difficulty to breathe. Okay, is it clear? Anyone want to add any comment, please, before moving to the next scenario? Always Dr. Mahmoud bringing the new scenarios and nice ones.
Yes, the patient now is not to fly. No, patient is pilot.
Yeah.
So it is, I think it is good thing to you will be assessed by the chest consultant and
Yes, better
as
to
you like.
refer. Always, by the way, many answer will be safe. Okay, it's not one answer. You have to say like this. No, many answer can be valid for this, applicable for this situation. But try not to say something harmful for the patient or harming his feelings. Okay, don't tell him no, you will never fly again like that. Okay, be gentle while giving or while delivering this message. I'm so sorry. It's difficult now to decide. I can feel you. As Dr. Sarah did, really, it was very sympathetic and empathetic. It's so difficult to feel that. I know it was your job and it's your dream to be a pilot, but some condition might be difficult to settle, and we have to find solution for that. Try to do your best to explain and to convince. This is the communication. It's a skill before or more than being. Uh, I mean, it's a skill, not something you can do it easily. So you try to train on this skill, to have this talent, how to convince the surrogate and try to calm him down from from the start till the end of the meeting. I mean the station. Okay. So we will go to the next scenario. If no one has comment, please. or we can listen to others. Okay, I will read the scenario until Dr. Mahmoud will be ready. Mr. Alfred Swallow, 80 years. Mr. Swallow has been in the intensive care unit for the last 2 weeks, being treated for cardiorespiratory and renal failure after emergency aortic aneurysm repair. Despite all active treatment has not improved, and the surgical ICU teams have decided to withdraw treatment. This has been agreed with the ICU sister as well. The consultant feels this should begin by tailing down the neutrobes first. This, in the opinion of the consultant, will probably lead to death within an hour, as Mr. Swallow has been dependent on high doses of neutrobes for a while. Mr. Swallow is well sedated and sedated with opioid and benzodiazepine, and shows no signs of distress, pain, or discomfort. The ICU sister has just told you that the daughter, Mrs. Wild, is waiting in the relatives' room to be briefed on the decision. I will share the scenario now. It's on the group, but I will share it here in the meeting. Dr. Mahmoud, take 2 minutes, then we can start. Anyone want to add comment for the previous scenario? By the way, there is also the change in the guidelines for admission and chest tube insertion for the chest for the pneumothorax. Also, I will share it. There is no more difference between primary or secondary. Both of them, if they have certain situation, you can admit the patient first and insert chest tube accordingly. But no more categorize for the primary or secondary or spontaneous or like before. The indication will be hypotension, tension in the thorax, large pneumothorax, severe hypoxia, and so on. The scenario in the chat box. Why the meeting today is silent? Dr. Muhanna, any comment? Okay, Dr. Mahmoud, when you're ready, let me know.
Still read the scenario. Thank you, Dr. Sar. Yes, thank you.
The task withdrawal of management. In summary.
Okay, I will speak with okay.
The Mrs. Wild, the daughter. No problem, take your time. I give you 2 minutes. I will give you 2 more minutes. If you're ready, let me know.
Okay. Let's see.
Ready?
Yes, Dr. Basis.
Okay. Next, I will share this slides for pneumothorax.
Mr. Swallow.
Ready, Dr. Sarah?
Yes.
Okay, here we go.
Okay. Good morning. Good morning. I am Dr. Musa, doctor in the clinic, doctor in the ward, medical ward today. Let me confirm you are the daughter of Mr. Swallow.
Yes, doctor.
Yes, nice to meet you. How would you like to call you?
Sophie.
Sophia. Hi, Sophia. Mr. Sophia, we are here to discuss about your father's condition. Is it okay with you?
Okay.
Okay, Mr. Sophia, to be in the same page, please, can you tell me how much you know about your father's condition?
Okay, doctor, my father here in the hospital for the last 2 weeks, and he has a lot of disease. He has like heart failure, lung failure, kidney failure, and he is on breathing machine. I know. I need you to update me about his condition.
Okay, Mrs. What's your name? Sorry, Sarah? Sophia. Okay, okay, Miss Sophia. Okay, Miss Sophia. Did you see your father today?
Yes, doctor. I have seen him today.
Okay, Miss Sophia. Let me explain to you your father's condition. As you mentioned, your father has been admitted here since 1 week due to repair. He has repair of balloon dilatation of the main blood channel of his heart. And I'm sorry to tell you that it is a major operation and has a lot of complication. And it's a serious condition. After the operation, he had some circulatory failure and breathing failure, and as you told, kidney failure. Now he is now in the ICU, in the ICU, in the ICU, yes, and he's treated by our physician. And despite all effort done for him, he didn't show any sign of improvement till now. He reviewed today. Do you following me? Are you
Yes,
following me?
doctor. Yes, I'm fine.
Okay. So you see your father today, and he has a lot of complication. Like he is now need for kidney replacement, and also a lot of medication used to increase his blood pressure. And as I told you, despite all effort done for him, he didn't show any signs of improvement. And I am sorry to tell you, your father has a little chance to survive. So, what do you think
What
about
do you mean,
that?
doctor? What do you mean, doctor?
Yes,
What do you mean about that?
yes, Mr. Sarah, I appreciate, I understand your concern, but he reviewed today by our consultant, and after discussion with the whole team, they recommended in the best interest of his condition and in view of his age, and he has a lot of complication and kidney failure. They recommend to stop all kind of his blood pressure support and circulatory support. And I'm sorry to tell you that.
What do you mean, doctor? Will you let him die?
No, sure, no. Can I ask first if your father has any wishes about what we will done after the operation, or like advanced directive or last power of attorney?
He didn't write anything about that, but I think he will not want him to die, himself to die.
Okay, okay. I appreciate your concern, but let me ask you, please, what is your father's condition before entering the hospital? What is his quality of life? Is he able to do his usual activity? Is he able to go around, go shopping? Can you tell me what is his quality of life?
Whatever his quality of life, I think he deserves to live, not to end
Yes,
his life.
I totally appreciate your concern, but according to your father's condition and his complication, like you mentioned, kidney failure and his bad condition now, if he is going to survive, he will have a bad quality of life. And in our practice, we put our patient dignity and his quality of life in the first priority. So what do you think about that?
So what will you do?
Okay, now your father has kidney failure, and he is reviewed by consultant today, and he is recommended in the best interest of his condition, and he is not going. There's no chance to survive again, and I'm sorry to tell you that it is no chance. It is literally chance. So what we are going to do now, we will stop all kind of support, his psychiatric support. And I'm sorry to tell you that he is dependent now on this support. So if we stop support this medication which support circulation, and I'm sorry, he is maybe going to die. And I'm
So you will
sorry.
let him to die.
No,
These steps will lead him to die.
no, actually, no. I totally understand and appreciate your concern. I know that your father is precious to you, and be sure that he is precious to us also. And we do a lot of effort, all effort of us and all team do their what they do to make him survive, to make him recover again. But actually, he had a serious disease, a serious disease to his blood channel. He has, as I told you, he has balloon dilatation of his
Okay, doctor.
main
Okay.
blood channel.
Okay.
Yes,
Okay.
okay.
Will he in pain? Will he be in pain?
Actually, no, understand your feeling, and I believe and appreciate your feeling, and understand that. But your father now, he is under complete no complete sedation. We are. He is here in complete pain management. He is followed by pain doctor. Taking some medication to keep him calm all the time and free of pain.
So how much time is still for him?
Actually, Mrs. Sophia,
2 minutes left.
actually, Mrs. Sophia, no one can predict this. But we are talking in about hours, not exceed about that.
So I should call the family to come and see him?
Sure. It is a good thing to do that. And please believe me, we do all our effort to make him recovery. But according to his procedure that he done, he has a high risk of death. So please يعني accept our feeling, accept your feeling. Okay, do you have any other concern?
No, doctor. No.
Okay, Mrs. Sophia, let me summarize. Your father has a major operation, which is repair of balloon dilatation of the main blood channel of the heart. So it is a major complication and have a higher chance of death. And he, after operation, he did the operation and has a lot of complication like kidney failure or circulation failure. He is now on drugs for to keep him pain-free all the time and support his circulation. And after discussion with the consultant, he recommended to stop all kind of support of drug support to him. And please make sure that we do all my effort to make him recover again. But I'm sorry, he was in better condition. Thank you, Mrs.
Okay.
Sophie.
Okay.
Okay.
Yeah. Thank you, Dr. Mahmoud. Dr. Sarah. She was tough
Okay.
as you. She tried to be tough as you. Yes. Okay, let's hear the comment from Dr. Sarah, then I will comment.
Okay, you keep telling me Sophie, Sarah. يعني you have to write the names and to memorize it. Okay? Okay. Okay, you also you did well, Dr. Mahmoud. But some notes here. First, the condition. You kept till this 3 times. You explain the condition 3 times. You can understand the condition and start. Yes, there is withdrawal, and yes, we will let him die. Yes, we are doing this, letting him die. We tried to save him, but his condition is deteriorating, and this is for the best interest for him. Okay. After that, yes, you talk about advance directive and if there is uh, uh, wishing well. Um, but you can talk about support. We can give you support. A support team like a grieving team or something like that. Asking about support for the family. Also, uh, yeah, I cannot remember. Um, okay, he is not in pain.
Eh,
Yes, yes, and we would start to withdraw medication and then to stop the machine. The steps of withdrawal. I mean. Okay, stop the medication and then withdrawing from the machine, and he will take a couple of hours till it end, and start the funeral arrangement. Okay, and this is the decision of the team, so you don't need to take this burden. Don't feel guilty that you decided to let him die. It is the decision of the team, of the treating team. Okay.
Okay, Dr. Sarah. But the
Uh,
difficulty here, he has 1 hour only to die.
yes.
He said it is 1 hour, but you can say a
Yes.
couple of hours.
No.
Yes.
Mm.
Okay. Okay, Dr.
Okay, Dr.
Sarah.
Bassem.
Yeah. Are you ready?
Yes, Dr.
Are
Bassem.
you?
Yes.
Yeah. I will give
Yes.
you a big dose today, but
Yes.
please accept it. Okay. You finished,
Okay.
Dr. Sarah?
Sure, Dr. Bassem, sure.
Yes, yes.
Did
Okay.
anything you have, Dr. Bassem.
Yes. I will say about your jargon. I think you fill the scenario a lot of jargons,
Yes, yes.
circulatory, and that's why you have
Hello, Dr. Bassem?
I can hear you, Dr. Mahmoud. I
Okay,
think.
okay,
okay. Sorry, I received a call again. Okay, so back. Don't
okay.
don't rush to start the scenario. You have to prepare yourself, write the scheme, how to do, what to do, in the steps, in a step, in steps, and be sure that you didn't miss anything. You miss here the support at totally. You didn't say about the support. Who's dependent on your father? Who needs some support? Do you need some support? Who's other members in your family? Do you need us to deliver this bad news to them? Instead of repeating or summarizing, which was horrible moments in
Yes,
these
yes.
meetings,
Mm,
don't repeat. Why you are summarizing? Something
mm.
will hurt her again. You are already hurted her feeling by saying what happened to your father and the second point, she asked you 3 times, you will let my father die, and you are kept saying no. And indeed, you are leaving him dying, right? So be honest. Yes, I am afraid to say, if we do this, your father will die. Okay, simply, it's the truth. Whenever you do this, he will die. So in fact, he is going to die, right? You said it. But you are denying that you are not letting. No, you are letting him die, but in peace. You can reassure him, we are doing this in the best interest for his condition. We don't, you said very nice word. We put the dignity of the patient on our priority, which is very nice. Yes, we put it in the priority of managing any patient, the dignity before anything else. And the dignity for your father now, not to harm him more. He suffered a lot in his life. So we are leaving him die in good way by putting him under effect of painkiller. Don't say sedation at all. So she asked you this question: will let him die while he has pain or while he's having pain? I appreciate your worry and your care. No, whenever we do that, we are trying to be sure that the patient is totally free of pain by our doctor. He is expert pain management doctor. He is doing that many times, and we are keeping our patient free of pain. Okay, this is our aim now. This is one of the dignity. Okay, and we don't want him to suffer more and to make his last moments comfortable as much as we can. This is the most important sentence and the task of your scenario. You will withdraw, but why? While you are withdrawing the medication or the support, you have to keep him calm and comfortable. Okay, so the withdrawal based on his previous condition, his suffer, and so on. Don't explain it frequent. It's one time only. He suffered a lot in his life. He has a lot of disease. He admitted with something called widening of some of his blood channel, which necessitates some intervention. After the intervention, his condition rapidly deteriorated, and the maximum support given to him, although he didn't respond. And as you said, you kept saying this in good way. We tried our best, but we noticed that he's not responding. So the team or the medical team decided to let him not to suffer more by withdrawing this support. Don't say circulatory. You can say we kept him on some medication to raise his blood pressure. However, it's not responding, or his blood pressure not responding to this medication. And when she asks you when or what time or how many minutes he will live or he will stay alive, do what's written in the scenario. They wrote in the scenario clear hour. So you can say minutes to hour. He can survive. Okay, Dr. Salah said a couple of hours, but it's not hours. It maybe less than hour. They wrote for you it's an hour. So try not to change the reality. It's written there. Whatever written, try to deliver. Stick to the scenario and stick to the task in the scenario. Okay, Dr. Mahmoud?
Yes, Dr. Bassem, sure.
And the name, it's very fatal mistake, very big mistake. Don't,
Forget.
no, don't forget. If you forget, look at the paper. Or you can say mom, you can say sir if there is male or female. But to make three different name in the same scenario, it's horrible, I think.
And the
So,
Mr.
so
Sarah. You said Mr.
yeah,
Sarah.
Mr.
Mrs.
Sarah, Mrs. Sophia. Mrs. Wild, and the patient and the daughter name in the scenario is Wild. No, no Sophia, no Sarah. I don't know from where what.
I
The
I
patient,
I try to keep it easy. Yeah, like more feminine. It is Mrs.
yes,
Wild. You can say, but he said Mr. Sarah.
it's
يعني
okay. We are learning from mistakes as usual.
okay.
Yeah, but at the end, don't summarize. Never ever summarize in breaking bad news, in mistake or medical error. It's a major mistake to repeat or to recap or to summarize in these things. Whatever you can do, do apart from or away from the summarize. So what you can do here in this scenario, you can tell her a lot of support. She need a lot of support. She told you, so I will call my family. Yes, who's dependent? Who's living with him? Who's also with you? Can I offer help for you and for them? All these things you can do it at the end. Please, if they arrive, we can arrange a meeting with our bereavement team. They can sit with them. They can deliver this hard news to them. And if they need any support, we can help for that. Okay. Let's go back to other point, which is advanced directive and lasting power of attorney. I am not sure if you can say it by these names. So the best way is, did your father express any wishes in his life? or did he nominate anyone to take decision on behalf of him? However, I don't prefer to ask or to ask about lasting power of attorney. Why? Because if you say that, she will tell you, I am the one and I am taking decision now to do the maximum support for him. And it will be against your decision, which is, no, I will not do anything. So don't ask this question preferably. So the best thing to do is any wishes for your life, for your father in his life. No, doctor, or she will say, yes, doctor. He wished to die in his home. He wished to die peacefully without intubation or putting him on machine. Either this or go ahead to the next step, which is closure of the scenario. Okay? Okay, Dr. Mahmoud, you got it?
Okay, Dr. Bassem, yes.
Yeah, please
Sorry,
accept.
Thank you.
Dr.
Accept.
Mahmoud. Sorry.
No problem.
No, we are learning. If you do this
Yes.
scenario again, I am sure you will do it in the perfect way. And
Yes.
if this scenario comes to you in the exam, you will do it also in a perfect way. Why? Because you learn from the mistakes, from your mistakes, and you know the mistakes already. You said before I start, you said yes, I know that I had jargons, I had a lot of things. Okay, so please
Okay.
avoid the jargon whenever you are saying, and if you said it, if you pronounce a jargon, okay, by mistake, let's say circulatory. I think circulatory something is also medical. So you can say circulatory support means some medication to raise his blood pressure, to keep him alive, to keep the blood in his blood channel, like this. Either to avoid the jargon totally, or if you mention it by mistake, explain it immediately. This is the advice regarding the jargon. Okay. Last thing about attorney, also try to avoid the name or this word or this term. The ventilator. You didn't say ventilator, but I mean if you want to say, you can say breathing support machine. The failure of the renal, you can say renal. Then you can say the kidney stop working. Okay, all these things will help you to avoid the jargon or to explain the jargons. You have any comment, Dr. Mahmoud, or any
No,
question?
very good.
Okay.
Thank you, Dr. Bassem. Thank you, Dr. Sarah.
Okay, thank you.
السلام عليكم. معلي بس ضيف
عليكم
ما
السلام ورحمة
شغلة
الله وبركاته.
صغيرة.
Yes, Dr. Hand, of course.
الله يسعدك، بس انتوا ناقشتوا على موضوع ال withdrawal انه
أها.
will the withdrawal kill the patient. هون في نقطة كتير مهمة انه ال withdrawal itself is not the cause of the death in the patient.
Yes.
The
Yeah.
underlying condition is the cause. So don't put your medical decision as a cause of death، لأنه هيك معناتها أنت you are يعني you will put
Killing,
yourself
yeah.
in an argument with the patient. So you should,
Yes.
at the time when she asks, will this end up by death or will my relative die? You will tell her that before taking this decision, already his underlying condition is not responding to treatment and
Mhm.
he is deteriorating and he will already die. يعني he is هذا إذا ما كان he is already dead كمان. تمام؟
Yes.
لأنه he is mainly dependent على machines without being able to do those functions by his own. تمام؟ And at this point, there is no benefit anymore, okay, of keeping him on those machines or on those medications. Rather, the risk is higher. First,
Mhm.
compromising his dignity. Second, putting him at risk of infection. Third, keeping him in the hospital for no reason, lengthening his life, lengthening his suffering. فبالنهاية أنت بدك تقنعها إنه نحن كان عنا هدف إنه نوصل ل good outcome. فما قدرنا
Yes.
نوصل ل good outcome و his condition is deteriorating
Mhm.
والريسك قلبت صارت أكتر من البنفيت. فat
Exactly.
this point the medical team for his best interest and to maintain his dignity and يعني smoothen his last days, we decided to withdraw those measures of treatment, whether intubation ولا inotropes ولا DNR ولا whatsoever. تمام؟ فما نحط ال cause of death أو even يعني إذا قالت لك طب will he die؟ فأنت على الأقل حتقول إنه he will die already يعني he is deteriorating and when we will stop the machines تمام؟ So we are expecting that the time remaining in his life will be very short. مو لأنه
Yeah.
نحن كمان عملنا withdrawal، لأنه كمان it's not making sense إنه he will live based على medication. He should live because we are expecting something, and now we are not expecting anything. We are not expecting recovery. We are not expecting any quality of life. تمام؟ فبس تكون هالنقطة هي واضحة حتى ما يفهم المريض إنه هو كان ممكن يعيش لو أنت تركته على الماشينز. بس ما نوصل هالفكرة الخطأ إنه هو كان ممكن يعيش لو تركناه على الماشين. فمثلا أنت ما بدك تتركه لأنه شهر شهرين، لا، هو لو كان حيعيش بتركه قد ما يعني قد ما احتاج الموضوع. فكرة إنه يعيش خلص we are sure he will not live any، يعني
Yes.
his organs damaged irreversibly. We cannot do anything. We cannot help. We are not expecting any outcome. فهدول البوينتس اللي يخلونا نتخذ قرار الwithhold or withdrawal. فبس ننتبه على هالشغلة. تمام.
Yeah. So we
غير
can
هيك
say,
تفضل.
yeah, we can say with or without this support, he will not live long. Yeah, simply, I mean, but you can do it with a good way.
تمام، بس انه اهم شيء ربط لما انت قلت له
Yes,
انه
yes.
عادي قل له انه she will die، حسيت انه هون انت كأنك اقنعته انه الديث سببه الwithdrawal.
But I
تمام.
said, I am afraid to say, if we do that, he might die after a short time because of the damage of other, or as you said. But I mean, the reality, he will die, but we will not let him die. We can say it in another way. Yes, she asked, you let him die. I can say, yes, I'm afraid to say, if we do that, he might die after some time because of the support and he's already deteriorated and so on. But not
هلا
as we let
انا
him die.
انت فكرتك انت انه بس قلت لها انه بعد ما نوقفهم هي فعلا
Uh-huh.
حتموت، لانه انت بدك تفهمها انه يعني خلص ما متوقع انها تعيش بعد ما نوقف
Yes, yes.
طيب على الاقل انت ممكن تقول لها انه الماشينز now are not giving her life. They are just doing the functions which she cannot do anymore. تمام.
Yes, yes.
she's already يعني we can say she is not alive. She's not doing the vital functions. تمام. It's the machine which are doing everything. لأنه هي كمان إذا بتتذكر بالسيناريوهات القديمة كان يقول لك إنه how come you are telling me this and her chest is moving and there is blood pressure ولا ال vitals numbers are there. فأنت تفهم بس إنه نقول لها إنه this is the machine effect. تمام. None of her organs are functioning and keeping her like this will put her at risk. تمام. So if we will stop them أنا معك إنه we are not expecting her to stay like
Yeah.
for a long time after stopping the machine, but it's not that she died because we stopped the machine. She has already
Yes.
lost her function, the organs function. Her life is already compromised because of the disease. تمام. And
Yes.
keeping her on the machines will not give any benefit. فيعني فكرة بس هالفكرة قبل ما تقلها صح كلامك أنت إنه we are not expecting her to live long after we stop them، لكن تكون
Yes.
هالنقطة هي واضحة قبل ما توصل لهالconclusion.
Yes, of
بشكل
course.
إنه ما يربط ما يربط إنه stopping the support is the cause of death. بس
Exactly.
يعني
It
ما
will
تصير
depend.
هالقصة الخطأ مع السيروجيت. بس هذا هو الهدف.
Yes. This question will come after good preparation. If you did good preparation,
عليك نور. ولو
yes,
انت اوريدي عرفته البنفيتس والريسك
exactly. Yes.
والكومبرومايزيشن والاوتكم يلي هو فيوتايل، فانت
Yes.
لو حكيت كل هالكلام ما عاد اصلا تحتاج انك
Yes,
ما عاد
exactly.
توصل لكونكلوجن غلط هو وقت حتقول له انه نحن حنوقف الماشين. كلامك جدا مزبوط.
Yes. Thank you,
تمام.
Dr. Hind.
وما ننسى أنا
Yes.
كأنه انتبهت أو ما انتبهت ما بعرف إنه لازم
Mhm.
تنقال إنه فكرة الwithdrawal it will be gradual. تمام. لأنه يعني we will not مثلا إذا كان هو على inotropes وعلى mechanical ventilation ولا عنده sessions dialysis ما بنوقف كل شيء مرة واحدة. تمام.
According to the task.
withdrawal process is gradual. تمام. So there will be enough time for him to say goodbye, enough time to call the family to say goodbye, enough time to spend with his relative. فيعني دائما في gradual
Yes.
process الموضوع هذا. ويعني just tell him إنه he will have enough time. لأنه
Yeah.
أحيانا
And
بحس منن إنه يعني there will be no time to say goodbye، ما حيقدروا حتى أحيانا
Yes.
بيقول لك can I call someone to come and check
Yeah.
on my dad ولا كذا. everyone have enough time تمام because it
Yeah.
will be a gradual process and it will take sometimes until everything will be until he will be off everything تمام.
Yes. You reminded me also about the concern. Can we wait for my father to come from Australia or from some different or far distance country to see my father for the last time? I think it's one of the concern, and we can address this concern by saying, yeah, we'll try our best. However, he might also have the death without doing that. So, and they will try to make it as long as we can or as much as we can to let your brother come and see him for the last time. This is
بس
one of
إنه
the concerns.
تحسسوا إنه your brother or whoever should come they should come as soon as possible لأنه
Yes,
the
of course.
process might not take long يعني
Exactly.
you
Yes.
have to you have to hurry up to
Yes.
catch him before we
Mhm.
stop everything because
Mhm.
also lengthening the process will increase the suffering or
Suffer.
compromise the
Yes.
dignity of your relative. So we should avoid this. So please, from your side, try to hurry up things. Bring everyone who want to say goodbye, okay? And
Mhm.
we will try to keep you updated about how long the process will take. So you can
Yes.
manage تمام with your relative. فأنت بالنهاية بدك تفهموا إنه نحن ما لنا مصلحة نطولها، فحاولوا
Mhm.
تعجلوا قد ما فيكم. وموضوع
Exactly.
ثاني السوشيال هيستوري لازم ينسأل فيه if anyone was dependent on the
Yes.
diseased
The father.
relative اللي حيتوفى تمام.
Mhm.
ف this is very important بالسوشيال
Mhm.
هيستوري يعني إذا
Yes,
في
exactly.
one question should be asked إنه is anyone dependent on him so you can offer support to those people who are dependent on the
Yes.
that يعني person.
Yes.
فبس يعني هدول الأشياء أعتقد المهمين اللي خطروا ببالي وأنتم عم تعملوا السيناريو.
Okay. Thank you, Dr. Hind. Always appreciated your comments.
يساعدك يا رب.
Yeah, yeah. Okay. Thank you, Dr. Hind. Any other comment from others? Dr. Ahmad Mansour wrote here, yes, offer in the last moments to stay with him if she want. If she raise it, yes, it's okay. Or to have a last look, okay, accept it. If she asks that, you can accept this concern. I mean. Again, Dr. Ihda asked about advanced directive and lasting power. As you decided already, so the best thing not to avoid the lasting power of attorney. He might or she might tell you, no, doctor, as I am the one taking decision on behalf of him, I order or I will request now to do everything for my father. So once you took the decision, don't let her or don't give her this opportunity to argue with you. The best thing to ask about is advance directive. Does he or did he express any wishes so we can help him in this? If no, skip to the next point. Don't ask, this is my opinion. But if you ask the last thing about attorney, she might argue with you and she will tell you, no, doctor, I have the power now to say no, continue supporting his life. And this is also controversy with your decision. So avoid this argument point. This is my opinion, okay? Anything else? Anyone want to add comment? Any question, any inquiry, any suggestion, Dr. Mahmoud?
Thank you, Dr. Basim. Very good. Thank
Okay,
you.
doctor. Okay, thank you too, Dr. Thank you, Dr. Sarah, as well. Dr. Mahanna, if you want to add anything for your friend, you want to comment on him?
انا معلش كنت درايفنج هوم
It's okay.
مش معاكم قوي يعني سامع
No
القصه بس ما
problem.
شاء الله يعني the last comment was very comprehensive.
Okay, Dr. Respect. Thank
ف
you, Dr. Mahanna.
well
Drive
done.
safely. Okay. Drive safely. Don't hold us
تمام.
fast. Okay. Okay. If no more question, no comment, we can end the session. We'll see you tomorrow, inshallah, with clinical day. Thank you, Dr. Hind, for visiting us today.
العفو
Hopefully,
العفو أصلا أنا
yes.
مشتاقة كثير والله أحضر معكم شكلي
Oh,
أكيد
me
ححاول
too.
أكون regular
Yes.
visit.
Try your best, inshallah.
الله
Hopefully,
يسعدك.
inshallah, we'll see you, inshallah, again. Okay, thank you, all of you. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.